Right. Hi, everybody. I wanted to start off and just say congratulations to everyone who's presented already. It's been really exciting to hear everyone's experience in their practicum, and I'm glad it's been such a positive experience for everyone. So I'm also going to talk about my practicum at the Community-Based Research Center. So I guess we all know a little bit more what to expect now in the presentation. I'm going to talk about my experience at CBRC and then go through the public health and social policy knowledge and values and some of the highlights of my practicum. So before getting started, I just kind of wanted to talk a little bit about my positionality in this work. I'm a white settler living and learning on the unceded lands of the Wasanich and the Kwangans people, colonially known as Victoria. I'm in the disability studies area of focus, but I am a non-disabled person, and I use she, her pronouns, and I'm cisgender. I think that being open about my positionality is really important to me, as a lot of the work that I do centers allyship and supporting communities in their work, and especially when working with communities that I don't necessarily belong to. So yeah, that kind of path of learning about positionality brought me to the CBRC. So the Community-Based Research Center promotes the health of sexual and gender minority populations through research and service development. They are based in Vancouver, but they have offices all across Canada, and all of my work was done remotely. So I had a lot of Zoom meetings with lots of different folks across the country. I worked on a wide variety of projects, including a project about chronic health, youth mental health, legal barriers, and drug use. So the key roles and responsibilities of my practicum, I did 2 different environmental scans, one for a chronic health study looking at resources, and the other for community-based research training materials. I also learned how to do some qualitative coding for interviews about barriers that queer folks face within the justice system. And I also did other support tasks for research processes, including report writing, lit reviews, and policy development. So for my practice scenario, I used an equity, intersectionality, and inclusion lens in community-based research. These are all terms that we've learned a lot about in the BA program, and it was really interesting to apply them to community-based practice. And I think the biggest thing that I took away from my practice scenario was definitely just the importance of communication and really being open to learning from people and really prioritizing lived experience. So 2 of the School of Public Health and Social Policy values that I prioritized in my work are written here. So the first one is critical analysis drawing on principles of social justice and equity. So this was shown in my work through engaging with conversations about anti-racism, systemic barriers, Indigenous leadership in research, and other things. I think a big part of this process for me was learning how to really listen attentively and make sure that I was learning from the people around me, because I was really blessed to be surrounded by people that had some really important insight on these issues. And the second value is creating partnerships with people to influence change and improve the quality of life for all people. So one of the setbacks of my program was it was all remote, but it also gave me the opportunity to talk to a lot of different people that weren't just on the island. So at CBRC, I got to create relationships with really cool people within the organization, but I also had the opportunity to attend a national webinar about queer youth mental health. And this was a great opportunity to see partnerships in community between folks in different sectors or disciplines. So that webinar included doctors and community organizations, community leaders, activists. So not only was it a cool opportunity to kind of see how that relationship building works, but it was just really cool to see how many people have similar values and wanting to create this change. So the knowledge areas that I wanted to discuss, the first one is gender as a social determinant of health. This is something that we talked a lot about in our program, and I wrote many papers about it over the past 4 years. But working in a queer organization, I learned so much about the intricacies of barriers in Canada that queer folks face and how complicated health is. So for example, especially when working on the legal problem study, I really got to learn a lot about how gender influences people's health, healthcare, and health outcomes. The second knowledge area that I wanted to talk about was reducing health inequities in communities through research. At CBRC, I learned the importance of community-facing outputs and transparency in creating a strong sense of community input and involvement. I think this is a really important aspect of reducing health inequities through research. Yeah, just having research really represent communities, I think, is so important because communities know themselves the best. The TRC call to action that I wanted to talk about, I know a couple people have mentioned it already, but it's the 22nd one, and it says, we call upon those who can affect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. So I hope to use this call to action as an important reminder to continue to listen and learn about my place in supporting Indigenous peoples in Canada. After working in community-based practice, I realized how important community-led work is. And as such, I think it is so important to listen to community and support them in the ways that they're asking for and the ways that they want. I understand that this learning is lifelong, and I hope to use this call to continue to advance my learning and to learn how to better support communities and work in allyship. Now for a few highlights. So as I've mentioned, Okay, we're back. So understanding my place as an ally, I had a lot of really important conversations with folks about being a cis person in queer organizations. And the next one is gaining a strong understanding of community-based research, really being in there and talking to people. I feel like I got a better sense of the practicum, of like my practicum roles in different research tasks, but also just the research cycle in general, and also learning from people with a wide variety of professional and personal backgrounds. And so finally, a lot of thank yous to Ben and Anu at CBRC. They were so supportive and I'm so grateful for them. Everyone here today, thank you so much for learning together, and definitely to my siblings. I wouldn't be where I am today without them. So yeah, thank you all for listening to my presentation.